So guys, I was discharged from the hospital, and when I got home, I got a number of boxes with all of the medication that I have to administer via IV from home. The nurse came to the house. She showed me exactly what I got, and she said to me, Polly, these are some of the meds that you have to give to yourself every day. So I took it upon myself to put it in some Ziploc bags and left it in the box by the side of the table so that the medication is accessible. What you see me doing right now is putting the individual bags back into the box that I'm going to leave there at room temperature. So each day I'll be able to just take a pouch out and utilize it.
I'm gonna have to give you a call back. What number can I reach you back at?
So there is no room to put me in, like you cannot let me know?
No.
I'm sorry?
Yeah, we have no.
See why we went to Turkey to get our mouth fixed and stuff? He is booked. He's the only guy. Isaiah, and to be honest, I called the office 20 times just trying to make an appointment. He booked up for the next 5 months. 5 months from now, if I get an appointment, I'll be dead. Hi guys, so this is everything that I need to expedite what I need to do, and from what the nurse showed me. I wanted to come on camera just to show you guys what it looks like. So I have the this is my jacket. I didn't want to be too naked on camera, but I'll put it on after because I have to step out as well. I have the PICC in my hand. It's PICC, that's what they say it's called, a PICC. So normally this is how she left me, and every day I have to administer this meds to myself. So I sterilized my hand, I got into the box, I took out all the stuff that I need, and now I'm going to do a procedure giving myself the medication. So first of all, I'm going to go clean my hands. So if you're sent home with this kit, you're also going to be sent home with a hand sanitizer. It's very important. I used to do nursing, and it's very important that you sanitize, because now you're talking about sterilizing information, sterile things that you have to have. I'm going to go ahead and put my glasses on because I need to see that to see. Yeah. So here we go. The first step. My babes is right here. Say hi to the camera.
What's up, y'all?
He's going to help me out a little bit. So the very first thing she said is that I have to, it's room temperature. It's at room temperature. I have to go ahead and break the medication. This medication is called ertropenem for injection, 1 gram vial. This is what it looks like, staying in the house here at room temperature. So I have to go ahead and break the seal here. That's what she says to do. So I'm going to break the seal because in the vial is powder. So I'm going to break the seal. I hope you guys can hear that. Here, listen. I broke the seal, and now I have to get some saline water from here and mix the two together, and then it should drop into there. You guys can see it's dropping into the bottle, and then once the liquid, the saline is above, like midway there about, then I begin to shake it and combine it together, you know. So this is the prep stage of it. So I just broke it, almost full. Hope you guys like this one. As I oftentimes say, go like, comment, and subscribe. Ooh, this is warm. It's warm, yeah. This here that combined together is warm, slightly warm. So she says shake. So this is what you do. Keep stirring it. I think I have enough of the liquid into it. Let me go ahead and take my phone off. Yeah, there we go. So the liquid it's still got some rocks at the bottom in it. So I have to make sure everything combines, yeah, correctly. So she says when it's all combined, the nurse, I keep saying she because there was a nurse that came by the house that showed me exactly how to do it. You know what I mean, guys? So once it's all combined, as you can see now, it's liquid form. It's liquid form. It's combined. Everything is combined. She says to go ahead. So put this liquid back into this liquid. So I have to go ahead now. It's all mixed. And honey, it looks mixed, right?
Yeah, it's about half full.
Yeah,
Yeah,
half full. So go ahead and turn it and put it back into here now. And that way you squeeze and release. Squeeze and release will allow the liquid to go back in. There you go. See, it's all back into the vial. So now that it's back into the vial, this now here is the medication that needs to be given to me for the next 30 minutes. Go ahead and put this up on the hook. You guys can see that. Put it up on the hook. So it's all ready to go now. Yeah. Next part now is to get the cord situated.
So you got to take the tubing out of the bag, and then you have to close the clamp.
Take this out of this bag. I want to wash my hands because I just touched, you know. I'm just paranoid, like a little bit like that. So I'm gonna clean. You guys will see me cleaning a lot, whatever. I'm not trying to. One of the biggest things they said with the PICC line is do not get an infection. Do not get an infection. They stress that so much. There's a reason why they stress it. This PICC line goes straight to my heart, so I don't want to get an infection. So I'm gonna open this now, and all these things are sterile. Right, so she says as you take it out, go ahead and close this out, correct?
Right.
So I'm gonna go and close this out. There we go, so just close. So the liquid does not flow into this right away. The next part I have to do now is
discard the sterile cover from the tubing spike, being careful not to touch the spike.
This cover comes off. This is sterile, it's clean. This cover comes off, that cover comes off.
Right, that's the next step. It says then pull off the rubber tab from the bag. So you gotta pull that, you gotta take that off, and then you gotta pull off the rubber thing on the
So pull this one off.
Yeah, be careful not to touch the spike. And then you pull off the rubber tab from the bag.
Yeah.
And push and twist the spike into the bag.
So take this rubber one off. You sure? Okay, there we go, came off. And then push this into.
Push and turn it.
Push and turn, don't touch, right?
Right.
Push.
Don't touch the spike,
Push it in.
Yeah.
Turn it.
Yeah.
There we go.
There you go.
It's in. That's in. Yeah.
And it says gently squeeze the tubing spike drip chamber 1 to 2 times where shown until the chamber is half full.
Squeeze this.
The chamber, yep.
Until it's full.
So it's half full.
Half full. So I'm squeezing. Teamwork here, guys. I hope you guys are seeing this.
Amazing, huh?
Is they seeing it, honey?
Should be seeing it.
So sorry you guys weren't able to see it. I left the taping up to my husband, but he wasn't focusing the camera in to the correct spot, so you guys were not able to see me getting it. But in another one, I'll show you guys again.
I think so.
Half full. It's
Can't
half
see.
full.
Yeah.
Okay. So then now.
So now you have to prime the entire length of tubing by turning the rate flow dial to open.
So this is open. This one here. It is open. It's unopened.
Okay, and then it says release tubing clamp. Release tubing clamp.
This here?
Yes.
Okay.
Watching fluid move down until a drop appears at the end of the
So
tubing.
it needs to come to this end, guys.
Yes.
So I'm releasing it. So yeah, there it goes. Oh my God.
It's coming.
It's coming.
He's coming.
It's coming fast. I don't want it to come too fast.
And then quickly clamp and turn dial to off.
When it reaches where? All the way through the
Until
air.
the end of the tubing.
Okay, so where is it? It's still here.
So keep it, you can't clamp it. You guys go all the way through to the end.
Yeah. That's to let the air out.
Yeah.
So there it is. It's moving. Moving down. Good. I hope you guys can see this. It's important, she said, to get the air out of it because it's dangerous to have air in your body. It's dangerous to have air getting into your body. So it's moving on the table. I can't show you guys. My husband could probably pan the camera. So it's almost to the end. And then turn it to off. Look, it's almost to the end. It's flowing in the tube. It's coming down. You guys can see that. It's coming down. There we go. Coming down. When it gets to the end,
it says quickly clamp and turn dial to off. I think you have to clamp it there too, huh?
Look at how much I'm leaving. No.
Turn dial to off.
It's off. Oh my God. Oh my God. I think I'm on off.
Yeah, it's not coming
It's
out
off.
anymore.
Yeah, this can't go. Yeah, so this is off. So now, oh my God, this is so much. Okay.
Okay, so now it says use a new alcohol prep pad to scrub the needleless connector on your IV and let it air dry. Do not touch tip after cleaning.
So I'm gonna take all of this off. This was holding the tape though, so it don't hit all over the place. I should go ahead and take this sock off as well too. I'm gonna take this off too.
Careful.
It has to be so clean, guys, everything. I'm gonna go clean this whole tube because it had, there we go. Yeah, I see it had tape on it. I don't know, there's tape all on it. Yeah, oh my God. So I'm gonna use a new pad. I have a lot of these, so then this here, take it off and clean this.
Yeah.
Oh my God, take this off. So guys, we're gonna of course take the camera off, and then we're gonna be back when this is closer to the end. I hope you guys like that one. I gotta sit here and wait.
Yep, about a half hour or so.
About half an hour. I'm gonna put half an hour on the timer, and you also cannot clog the line. You just have to leave the line flowing. So basically sit here without touching anything. I'm gonna sit here and just allow it to do what it do. Right, honey?
That's it.
What do you think?
Yeah, that's it. We'll be back to show you the end.
Yeah.
About 30 minutes.
That's a slow drip though. That's a slow drip. So I'm just sitting here, guys, getting ready, scrolling through my TikToks. Oh, follow me on my TikTok. It's Pollys. Yep, so while this is going, we should be almost done. I think it should be almost done soon. I still like have a lot in the bag though. The girl is going, yeah, Star Polly. That's my TikTok and my Instagram, Star Pollys. Star Pollys. Yep. So I'm watching something. I just dropped one as well with me getting meds and stuff. So, you know, if you want to check me out, go on and check your girl out. Like, comment, subscribe on my YouTube channel. Yeah. Star Pollys and Polly's World. Real cool, you know what I mean? Just scrolling through Instagram, watching some of the stuff that is taking place. There we go. There we go. That is 30 minutes, honey. 30 minutes on the timer, and it's up. However, 30 minutes is not up here, so I think I have to go some more, right, honey?
Yeah, probably increase the speed a little bit.
Increase the speed, yeah. That's what she did last time, yesterday. She increased it a little bit, so I'll increase it just a little bit. It seems like it's moving so slow.
Yeah, slow going.
It's a slow drip. The most important thing, we don't have any air in the lines. That is key. I felt it going through, so it's working. It's doing what it do. So just wanted to give you guys, come back in and give you a quick synopsis. Yeah, I'm just doing what it do still. So what can we say?
That's it.
Just sit and wait, right?
That's it.
So I'm just gonna wait till it gets to the end. When it gets to the end, I'm gonna show you guys how we do the conclusion. I'm not gonna raise it higher than this because this is how she had it when she was here. She didn't go higher than that. I'm just gonna do what she did, you know?
That's it. Let gravity do its thing.
Right, that it just, yeah. So I'm just sitting here, I'm just letting it do what it do. So Huzzy gonna take the camera off, and we'll come back in when it gets to the end, very, very end. Ooh, I need some water. My head feeling light. Right here, a bottle of water. Just grab me a bottle of water. Ooh. Yeah, and that's one thing I remember my sister, because my sister's a nurse also, she said to me, Polly, when you're taking this, you need to drink a lot of water. I forgot about that. I didn't drink no water for the morning yet.
Did you eat anything today?
I didn't really eat that much, guys. You guys know by now.
I
didn't show. I wrote it down. Look at
okay.
it. I'm lying. Look in the bottle there. You see?
Mm-hmm.
I wrote it down. Look, I see a bottle of Inshaw. I had some Inshaw, vanilla flavor. That's like a meal.
Yummy.
Tasted it. I need to drink more water. I'm gonna taste that one. So I'm gonna just let it do what it do, and when it gets to the end, I'll come back in and close it out. Yeah, this is gonna probably. I wanted to insert this into a video. Maybe clip some of it, but this is like a whole video by itself.
Yep.
So, taste it in my tongue, honey. Anyway, I'll come back in, guys. So, it's done, guys. I believe everything is done. So, baby, gonna step back into the roll and just give me a synopsis of what to do. Back again, so let me go ahead and clean my hand. You wanna clean your hands? Your next hand up. There you go. Yep, he stepped away from it, so to come back into the scene of this sterile area, it have to be sterile, right?
Right, that is correct.
Everything must be what?
Sterilized.
There you go. Good. So, here we go.
Okay, so it says when medication bag is empty, clamp tubing and remove from needleless connector.
Clamp here. Is all the liquid in my body? Yeah, it looks like everything is out, yeah. I got all of it. So I clamp it and then disconnect here.
Yep.
Disconnect. There we go.
I think you connect it from your arm.
What?
That doesn't matter. I mean, at the end of the day, that's all going in the trash. Just disconnect it from your arm.
From the arm or the bag?
The arm.
Okay, disconnect it from the bear.
Mm-hmm.
Okay. There we go.
Okay, and then you gotta flush with the saline.
Okay. So before we focus on that, let's focus on me.
Right.
Okay. Oops, why the jacket goes running away.
So
So
you
this
gotta
is
make
the
sure
saline.
Right, you make sure you get an alcohol pad to scrub the tip of that again.
Clean it again. Give me another
Yeah.
pad, honey. So this is the saline here. Saline is. Go ahead and clean again.
Yep, clean again.
Open this up.
Yep.
Go ahead and make some come out, the bubbles.
Yeah.
There we go. And then connect and deliver the saline, right?
Correct.
That's in. And then administer it nice and slowly.
Yep.
See, the numbers are going down. Nice and slowly.
Mm-hmm.
Okay, that's done.
Right. You take that off and you're going to clean the port again.
Why didn't she not use all this? She did not clean this one.
I mean, that's what the instructions say to clean it so much. I guess she was confident that it was
Okay, clean it again.
clean again.
Let it dry.
And then you want to use the other syringe.
And this
with the
one
heparin.
is now, this is heparin, it's another drug.
And just to make sure it doesn't clog or.
So open it and do the same release like what she did the last time.
Correct.
Get the bubble out, she said. There we go. The air. There you go. I felt the release.
Yeah.
So then connect it.
Yeah.
And this one, administer slow again.
Yep.
How slow for this one?
Doesn't say. I'll say about
Just
15
slow. 15
to
minutes?
30 seconds.
Seconds. Okay. 1, 1,000. 2, 1,000. 3, 1,000. 9, 1,000. 10, 1,000. 11, 1,000.
That's the slowest 15 seconds ever.
1,000. Here we're 13, 1,000. 14, 1,000. 15, 1,000. Some is still in it. No?
Then after removing the syringe from the needleless connector, clamp your IV line if instructed by your nurse.
So when this is done now, the last thing that is sitting on the table is this sterile cap.
Correct.
So do I have to clean it again?
No,
You sure?
doesn't say to clean
Okay, so remove that. Just for the sake of it, I want to clean it.
it. Okay. There you go.
I'm gonna clean it. This is so you don't get any infection, guys, because they say you can get infection really bad. Clean it and then wait for it to dry. It dry. See it dry there? And then go ahead, open this cover that they give to you. It's a little green cover. You open it here like this, and then there is some sterile alcohol in there, and that goes in here. Closes back up the line. We did it.
That's it.
And then this here, she wrapped it around my arm. I think I'm gonna do what she did the last time. She wrapped it. The nurse that came, I just don't like how that bends so high. Wrap it around the arm like that, so that stays pretty much there in place. And then I get to put one of these little socky things that they give you on the arm. It itches my arm, guys. I'm gonna ask my husband to hold this. I'm gonna open it out as much as I can because it really hurts my arm. It's so tight. So I'm gonna stretch it. There we go. Open it out. Like your hands are still clean, right?
Yeah.
Hold it there like that for me. I'm gonna put my hands in. Okay, you can release now. Thank you. And then I'm gonna just feed it up the arm. I stretched it too big. I stretched it too big. Oh my God. So I'm gonna use this one. Should I use a new one?
Yeah.
I'm trying to get sick from nothing. So I stretched it too big. There you go. I'm not gonna stretch it that big, that wide. There we go. Something else was time. You have something on the fire? Yes? He does. He has something on the fire. You go over to his dressing time, honey?
Yep.
So I'm gonna stretch that out. I'm gonna go ahead and rest that on there. There we go. Cover it up because I gotta step outside now. I gotta go out. I'm going to the doctor's office now. So there we go. And that's how you administer the medication through the PICC line. All of this can be just thrown into the trash just regularly. There you go. That's done. It's done. It's done. That's our first time administering it by ourselves. What do you think, honey? Quick synopsis.
I think it was a little
Excessively cleaning.
yeah, excessively cleaning, but we're a little cautious at first. But as we get used to it, we'll be a little bit more confident.
Yeah, I think.
And it'll go faster.
Okay. So this here is gonna go in the trash. Yeah, just wrap everything up. There we go. I'm gonna go ahead and throw it into my trash. And then, of course, as per usual, I'm gonna go ahead and clean my hands and then get ready to step out. Guys, I hope you guys like this one. I wanted to show you guys this as well because, you know, I take you guys on everything that I do. So I was like, since I'm gonna do my IV, why not take you on this also? And then I put my stand and everything back for tomorrow, next day. And I hope you guys appreciate this one. Don't forget to go like, comment, and subscribe. Shoot it up in the comment section for your girl. You know, I bring you all of that good, juicy, meaty content. Everything that happens with us, as long as my husband is okay with it and my kids, I'll take you on that journey as well. This one was pretty informative. I like this one. So if ever you are in the hospital and the doctors say that we are going to be putting the PICC line into your arms, you don't have to be scared or fearful. You too can do it. If you see me, regular girl, did it, you can do it too. So don't be scared. This way it helps you to be able to get the medication that can kill the bacteria in the body. What do you think, honey? Anything you have to say before you go?
No, I think that, you know, you just gotta trust the professionals. They did a great job training you. Follow the instructions.
Yeah.
And you can't go wrong.
And they also give you this here. It's a guide, step by step, as regards to what to do, how to do, set up, all that. So if you follow it, you should be good too. So I'm on hold, so I'm gonna go over here and talk to you guys quickly. I am on hold right now. I was discharged from the hospital. Second day, I literally at my 20th call calling this doctor, trying to get an appointment to go in to see them for him to take a look to see when he can extract the implants at the bottom. Literally on hold. This is what the 20th call I called and I just got through. So now I'm on hold. When they come back in, I'll come back in, guys.
Schedule, so I'm gonna have to give you a call back. What number can I reach you back at?
So there is no room to put me in, like you cannot let me know?
No.
I'm sorry?
Yeah, we have I can't even make that decision. We have to create an appointment of where we can put you in because there's nothing.
Okay,
so
quick question for you, my darling. Before I give you now, because I've been trying for this is about the 20th time I try to call you guys. Quick question I have for you. So can anybody else in the office see me? Because I think it's 3 other doctors there.
Yeah, do you need to see Dr. So what number can we reach you back at?
Yeah.
I will call you back as soon as they give me a date, and it will be today. I will call you back today.
Thank you.
The appointment today.
And what's your name, my dear?
My name is Tina.
Tina, okay.
And were you released from the hospital today?
Yes, I got released yesterday.
Oh, yesterday. Okay.
Yeah.
Okay. All right. Okay. So I will call you back. Okay.
Okay, Tina. But the whole thing is because of the antibiotics that is so sensitive as it to time.
Yes.
You know.
Yep. I know. I told them that.
Thank you so much, Tina. Appreciate it. Whatever you do for me. Yeah.
Okay.
So, guys, she said I gave her my information, my number, everything. Listen. A lot of people take things for granted. This here is a serious situation because of the infection that can go to my brain and I could drop it. The doctor said that. He said this can become fatal.
Yeah, it's right by the brain.
Fatal. It can become fatal. And this doctor is just dragging his butt. Just dragging his butt. And what I'm angry about, he's the only one in this area that does it. See why we went to Turkey to get our mouth fixed and stuff? He is booked out for the next 4 to 5 months. So must I just be on antibiotics for the next 4 to 5 months? Is that what they're telling me to do?
Right, I can't be healthy.
So guys, this is the conundrum that I'm going through while outside trying to find the correct doctor to take the implants out. When I tell you, I'm taking you guys on every journey because, as I say, I like to take you guys in the good, the bad, and the ugly. And here we are. Hope you guys appreciate this one. As I often say, as per usual, good, meaty, juicy content. Go on now, like, comment, and subscribe. Hit the notification so you know what next is happening. I just spoke to Tina and she says she's gonna try to call me back. She said I'm gonna call you back before the day. If that call doesn't come through, I'm gonna show you guys no call came through as well. The only guy in this area who could take the goddamn dental implants out of my mouth. He's the only guy. Isaiah, and to be honest with him, I called the office 20 times just trying to make an appointment. He came in the ear very nonchalant, like he didn't even care to hear what I was saying. When I called his office, they're so booked up. He booked up for the next 5 months. 5 months from now, if I get an appointment, I'll be dead.
Jesus, like you can't go to someone else.
It doesn't have anybody in the area where we live at that can do it. Who's an oral surgeon, MDDMS, KUK, ABCDJJ, can't be behind the name. Shit.
Well, you can't go to someone out the area to get them out.
Because he came to the ER. That's what I was saying. Could I go to somebody else? But because he came to the ER and he saw me, he deducted that the refer on the piece of paper.
Oh, so it's like you have to go there.
Correct. Like, I have to go there. If he know he was going to be booked out in 5 to 6 months, why did you put your name in the ER roster of oral surgeons? Why?
Especially since you need it like out.
ASAP. You need it ASAP out my mouth. I need it like ASAP out my mouth.
I don't know, Mom.
I know, Isaiah. Whatever. How are you doing?
Okay, Mom.
Said end and accept. Hello, good day. Hello?
Hi, is Pollyanna available?
Speaking.
Hello, this is Tina.
Hi.
Calling from Doctor's office.
Yes, ma'am.
Hi. Okay, so they're going to create an appointment for you. So
Okay.
he's triple booked that day, so you'll have to be patient because they're working you in between his patients.
Okay.
And then let's see here. I just need some information. So he's going to be seeing you for your implants that are infected?
Yes, he says he was going to remove the 2 lower implants and give me an assessment as regards to what next, what, and what.
Okay. All right. And do you remember did he ever say what tooth numbers they were? Or?
Okay. Well, the ones I know because I was number 19. It's not there isn't a tooth there. It's just the implant into the bone. So it just happened in June.
Okay.
So I don't even think it's merged into the bone just yet. I don't know.
Okay. All right. And did we do the implants?
No.
Okay. And
I went to the ER and the ER referred me.
okay. Because he was the oral surgeon on call that day. Do you have insurance?
I do. Let me just get the information. Yes, ma'am.
Okay.
So what day are they looking to put me in?
On Monday.
Monday
at 2 o'clock.
on Monday
Yes.
at 2 p.m.